Certainly, let's delve even deeper into various aspects of syncope, focusing on specific diagnostic methodologies, comprehensive management strategies, detailed case studies, psychosocial implications, and future research avenues. Indications for EPSERS, patients with recurrent syncope and suspected arrhythmias after non-invasive testing is inconclusive. History of syncope associated with significant heart disease or structural abnormalities. Procedure involves placing catheters in the heart to assess electrical conduction and identify arrhythmias. It may also include programmed electrical stimulation to provoke arrhythmias under controlled conditions. Transesophageal echocardiogram, or T, provides detailed images of the heart's structure and function, particularly useful for detecting structural heart disease that may cause syncope. MRI and CT scans are considered in cases of suspected neurogenic causes of syncope, such as vascular malformations or tumors that might affect blood flow to the brain. Comprehensive blood work, including screening for anemia, electrolyte imbalances, thyroid function tests, and inflammatory markers, can help identify underlying systemic issues contributing to syncope. Tailored treatment plans by syncope type are essential for effective management. Neurocardiogenic syncope management involves patient education. It's crucial to teach patients to recognize early symptoms and perform maneuvers that can, prevent syncope. Physical therapy includes programs designed to improve muscle tone and venous return. These exercises are typically focused on the lower extremities. Orthostatic syncope management can be aided by using compression stockings. Graduated compression stockings help improve venous return and, mitigate symptoms. Pharmacologic options include the consideration of fludrocortisone or midodrine for patients with chronic orthostatic hypertension. Cardiac syncope management may involve device therapy. Implantable cardioverter defibrillators, or ICDs, might be necessary for patients with severe arrhythmias or structural heart disease. Lifestyle adjustments are important too. For patients with a history of arrhythmias, avoiding known triggers, for example, excessive caffeine and dehydration, is crucial. Case study 1: young female athlete. Presentation: a 17-year-old female experiences syncope during a soccer game. Evaluation: ECG and tilt table test are performed, revealing a vasovagal response. She is educated on hydration and recognizing prodromal symptoms. She is advised to increase fluid and salt intake, and her training schedule is adjusted to avoid prolonged standing. Case study: 2 elderly male with cardiac history. A 72-year-old male with a history of coronary artery disease presents with recurrent syncope while gardening. Evaluation: an echocardiogram shows aortic stenosis, and Holter monitoring reveals episodes of bradycardia. Management: the patient is referred for surgical evaluation for aortic valve replacement. A temporary pacemaker is placed until the surgery is performed. Impact on daily life. Quality of life. Patients may experience anxiety about future episodes, leading to avoidance of activities that could trigger syncope, for example, exercise, driving. Social isolation. Fear of syncope can lead to withdrawal from social interactions, impacting mental health. Support mechanisms. Counseling services, psychological support can help patients cope with the anxiety associated with syncope. Cognitive behavioral therapy, or CBT, may be beneficial. Family education. Educating family members about the condition can support the patient and provide assistance during episodes. Wearable technology. Smartwatches and monitors. Devices that monitor heart rhythm and provide alerts for arrhythmias can help in early detection and management of syncopal events. Mobile apps. Applications that allow patients to log syncopal episodes and associated symptoms can facilitate better communication with healthcare providers. Genetic research. Familial syncope disorders. Ongoing studies are exploring genetic markers associated with inherited arrhythmias that lead to syncope, potentially guiding screening and preventive strategies. Artificial intelligence in diagnostics machine learning algorithms, AI, is being used to analyze large data sets to identify patterns in syncope episodes, which can help in predicting risk and tailoring management. Standardized protocols. Clinical pathways for syncope. Development of evidence-based clinical pathways to standardize the assessment and management of syncope across healthcare settings. Outcome measurement. Tracking recurrence rates. Collecting data on syncope recurrence and related complications to evaluate the efficacy of management strategies. Public health implications community awareness programs. Education campaigns initiatives to educate the public about recognizing syncope and understanding when to seek medical help. Screening programs. Targeting high-risk populations, for example, older adults for education and screening to identify underlying causes of syncope. Access to care, improving access. Ensuring that patients have access to appropriate diagnostic testing and specialist consultations, particularly in underserved areas. Syncope is a complex clinical phenomenon with a wide range of potential causes and implications. A thorough understanding of its pathophysiology, robust diagnostic protocols, tailored management strategies, and attention to psychosocial aspects are essential for effective care. As research continues to evolve, innovative technologies and approaches will enhance our ability to diagnose and manage syncope, ultimately improving patient outcomes. If you have specific areas of interest or further questions, please let me know.